Hello there, I'm Sarah, your natural endometriosis expert. Welcome to my podcast. This is the place to be for information, advice and tips on managing your endometriosis naturally. I've been managing my own endo now successfully for about 20 years, and I've been running my own therapy business since 2008, helping others to do the same. If you're curious to cut through all the noise and rubbish that's out there and learn the key to managing endometriosis with minimal reliance on drugs and surgery, then this is the only podcast you'll need. Let's get started. Hello there, welcome to this week's podcast. So this week we're going to be talking about back pain. It's not necessarily one of the pains that spring to mind when we talk about endometriosis, but it's actually one of the most common pains that I see in my practice. So women come to me not necessarily because they've got back pain, but actually when we start to monitor their symptoms, when we start to track everything that they've got going on, back pain can be a really significant issue for a lot of women. Now, a lot of women haven't made any connection between their back pain and the endo, and when they start to track their symptoms, then this link becomes apparent and it can cause a lot of anxiety. So the first thing that I want to say this week, if you are experiencing back pain, if you do notice any trends, any clear link to your endometriosis and your menstrual cycle or your endo cycle, then the first thing to do is not to worry. The vast majority of women that I work with don't have endometriosis on their spine. They still have spinal pain, they still have back pain, but that doesn't mean to say that the endo is on their spine or in the region of their spine. I think in all the years I've been doing this, I think I've only worked with one woman who's had endometriosis in that area. The rest is what we kind of refer to as deferred pain. So the first thing to say is if you are really, really concerned, if you're concerned that your endo has spread to that area, to your spine or to your back, then please do go back and speak to your surgeon, speak to your consultant or your GP. But just to reassure you that the vast majority of women that I've worked with over the years who have back pain, it's linked to their endo. It's not caused specifically by endo adhesions or lesions or anything like that. So just as a bit of an initial reassurance. But that doesn't really help if you're struggling with excruciating back pain, either constantly or at various parts of your cycle. The reason that you've got back pain is one or two things. There's one of two things going on, possibly a mixture of both. So the first thing is that we look at cause and effect. So it can be something that's actually causing, or one of your causes, part of your cause of your endometriosis itself. So if you do delve back into your endometriosis, if you are familiar with the cause and effect of endometriosis, or the cause of endometriosis anyway, then there are a couple of causes that can be signalled by back pain. So when we talk about the causes of endometriosis from an alternative medicine point of view, we talk about blockages in our abdomen. We talk about things that are stopping the flow of energy, the things that are stopping the flow of blood from passing through our abdomen freely. One of these things can be a physical injury, so a historical physical injury. So if you have something like a pelvic tilt, if you have a tilted uterus, if you have a subluxation or a fused spine, then that can cause the blockages in your abdomen that we associate with endometriosis. So it's worth looking into your back pain a little bit more detailed. So when did your back pain start? Is it a result of an injury? Is it a historical injury that goes back ages? Does it predate your endometriosis? Now, one of the things that we can also look at is childbirth. So if you have had children and it was a difficult birth, do you have any residual pain, any residual trauma from that childbirth? So quite often I have worked with women in the past who have had absolutely no endometriosis symptoms until after their children have been born. And one of these reasons, one of these causes, if you like, is very probably due to the traumatic birth and the residual trauma, the physical trauma that resides after a difficult birth. So if you have any of these things, if you have a tilted pelvis, a tilted uterus, any subluxation of the spine, any fused spine, any physical injury or fall that hasn't knowingly left any marks, but every now and again you just get some back pain, then that could be one of the things that's causing your endometriosis, again, from an Eastern medicine point of view. When we get those physical injury scars, or even just the slight physical changes in our body. And that could just be muscle tension, because if you've listened to my previous podcasts, or if you've watched my free video about causes of endometriosis, then you'll know that muscle tension is one of the main causes. That's one of the sticks or the branches or even the trees that fall across our rivers of flow of energy and of blood. So muscle tension, subluxations in the spine, all that kind of stuff can really be detrimental to our abdominal health and can even cause endometriosis. It could be a trigger as well, doesn't necessarily have to be a cause, but it's one of those underlying things. And as you know, in terms of the way I look at symptoms, causes, triggers, a trigger or a cause can also become a symptom. And if that's the case, so what can happen when we start to experience pain? So this is exactly the same if we're talking about shoulder pain, if we're talking about neck pain. The original site of the pain might well become pain-free, but actually the pain spreads. So what became a slight sore neck can turn into a migraine, can turn into a frozen shoulder, because the muscles and the soft tissue around the original injury, around the original pain site, start to tense up. They do that to protect the original pain, to give the pain and the injury site time and space to heal properly. But muscle memory is a really powerful thing. So the more tension we invite into our lives, the more stress we are under, the more pain we feel, because everything is just tightening up, everything is tensing up. And it's exactly the same with our backs, it's exactly the same with our abdomen. So what could have started as a simple injury, and like I say, the original injury might well have disappeared, it might well have healed, can leave residual tension within the muscles, within the soft tissues around that area, in the soft tissue around that area. So even if you don't feel as if you still have the original injury, or if you know that the original injury has cleared up, just tune into your body a little bit and just see whether there is any residual tension there. That residual tension can be the blockage. Then the more the blockage is there, the more pain you're feeling, the more that toxicity level is building up, the more that, as we call it, stagnation is getting there, then the more the pain gets again. So it becomes a trigger and it becomes a symptom. The symptom then also becomes a trigger. To break that cycle is to stop that pain, and we'll talk about that in a second. We also have the emotional components that, as you know, we have, especially when it comes to cause and effect of endometriosis. So the emotional cause can be just as powerful as the physical cause. So we have in our lower back, as you know, a lot of our emotions, or each one of our emotions, is stored in a different area of our body, or different areas of our body. So in our lower back, in our kidney area, that's a massive store for emotions such as fear, grief. You know the phrase stabbed in the back, there's a reason for that. Emotions of betrayal are also stored in the back. So if we're holding on to those types of feelings, if we're holding on to fear, grief or betrayal, then that can sit in our lower back. And again, that can cause tension because that becomes physical. We physically feel the emotions that we also are mentally feeling. And when those emotions become physical, that's when we're seeing tension, that's when we're seeing it cause pain. So we've got the physical injury aspect, we've got the remnants of the physical injury, and we've also got the emotional aspect of that as well. Fear and grief obviously also sit within our abdomen as well. So if you are holding on to those emotions, then you're kind of giving yourself a double whammy. You're getting the back pain and you're also getting the abdominal pain. And as I've already said, we have that referred pain. So we have that pain that we experience pain in different areas to where the actual injury or where the actual tension is. It expands. The pain expands and the tension expands. That doesn't mean to say that the pain you're experiencing isn't real. That doesn't mean to say that the emotions that you're feeling aren't real. It's just being exacerbated by the tension in the body. So the key thing when we're talking about pain management, the key thing is to break that cycle of pain. So there's various ways to do that. It all depends whether you respond better to physical intervention or emotional intervention. I always recommend doing both because, as we've seen, the emotions that sit within our muscles are really, really powerful. So if we just get rid of the physical, so if you're just having massages, if you just go for cupping therapy, if you're just having that physical intervention, but you're not clearing the emotional trauma that sits behind it, then you will get short-lasting results, exactly the same as if you're just treating your endometriosis symptoms without looking at the triggers and the causes. You're just getting short-lived results. You'll have it's the same when people come to see people like me for back pain, neck pain, shoulder pain. If you just look at the pain, if you're just relaxing the muscles and just doing the physical massages, then that person will walk out of your consulting room feeling amazing. They will feel so relaxed, they will feel awesome. But if they're not looking at the emotional causes, at the underlying emotional causes or triggers, then all of that muscle tension will start coming back and their pain will start coming back. So I would always recommend looking at both. So find a physical therapist that can help. So anything such as physiotherapy, core therapy is really good. Massage, if you can. A lot of women who I work with endo don't actually like massage. They find it quite intensive, but you don't necessarily have to have a full-on sports massage. The lighter kind of aromatherapy massages. Do something that works for you on a physical level, and then also find something that works for you on an emotional level, and hit them both hard. So if you're struggling with emotions like fear, if you're struggling with emotions like grief, find people who can help. So talking therapies are fabulous. If you're not really a talker, if you find that talking kind of makes you relive the trauma, relive the feelings that you're feeling, then you might want to start somewhere different. So emotional freedom technique, you can do things like Reiki that address both the emotional and the physical, but just make sure that you are tuned into the emotional as well as the physical. Also look at things like, so this is when it comes to tracking and really sort of paying attention to the wider picture of what's going on in your life. So we've talked about the emotional, but look at how your life is impacting you emotionally. Are you putting yourself in situations, are you experiencing situations regularly that make you feel any of those emotions? Are you walking differently? Are you sitting differently? I mean, if you're experiencing back pain, then we will be doing, well, so to be honest, any sort of pain, if you're experiencing any sort of pain, then you do things differently. My dog was lame on her back leg the other day. And she then started to, she's got arthritis anyway, bless her, but she then started to go a bit lame on her opposite front leg. And that's called the love-it relationship, where you start to see areas of your body experiencing pain that's almost like a direct mirror to the area of the original injury, if that makes any sense at all. So for example, in people with left hip pain, they might find that they suddenly have right shoulder pain. That's exactly what was happening with my dog. That's not deferred pain necessarily. That's not, although it can be, it's not necessarily that the muscle tension and the muscle aches and the soft tissue have all tensed up between the hip and the shoulder. Essentially what's happening is it's because you're walking differently, or you're standing differently, or you're sitting differently, but all of the tasks that you do, that you spend a lot of time doing, you will be distributing your weight differently to protect the original injury. So my dog was lame because she had like a little boil on her foot. So she was walking differently. At its height, she was sort of lifting a paw off the ground and walking on three legs, which is fine for maybe, I don't know, an hour, or not constantly for an hour, but you know, it's fine for a little short space of time. But the more you do that, the more pressure, the more tension, the more stress you're putting on the other areas of your body. So if you think about it, a dog's a great example, because if you think about her on her forepaws, if you take one of those paws off the floor, then she's pivoting forward, and she'll be pivoting slightly to the opposite side of the foot that was damaged. So the opposite shoulder is going through a lot more stress and strain, and we're exactly the same. So we could be experiencing pain somewhere completely different that's making us just sit at our desks differently. So when we're talking about abdominal pain, which is obviously going to be causing is if you have pain as one of your core endo symptoms and you're experiencing abdominal pain, then you will be sitting differently, you will be walking differently, you might be spending a lot of time in a completely different position to what is actually your natural position, and that's going to be putting a lot of strain on your lower back. So it's not necessarily that the pain is also linked to the cause of your endo. It could just be that the pain is purely a symptom, and the more you track, the more you notice, the more that will become apparent in terms of which one's which. But whether it's a symptom or whether it's a trigger or a cause, the way of addressing it is exactly the same. So exactly like I say, do Pilates, yoga, core therapy, physical massage, also things like Qigong and Tai Chi. Again, we're using energy, so we're looking at emotional blockages as well through things like Qigong and Tai Chi and Reiki. But predominantly, the Qigong and the Tai Chi are more physical, so you'll be inviting gentle movement into your abdomen, into your lower back, into your upper back, into your shoulders. That will be clearing the physical tension as well as giving you an element of emotional release. And then things like acupuncture, that's exactly the same. So that looks at the blockages as a whole, that frees up your energy system, that gets rid of emotional and physical blockage. But again, getting specific things like counselling, emotional freedom technique, journaling is a really lovely way of addressing some emotion, but you just be a little bit careful with this, because if you are struggling with intense emotions and deep-seated trauma, then journaling can actually bring up some things that you need some sort of professional help with as well. So that's just a little bit of a mindful reflection, or a mindful reminder that some of these things can actually be quite deep-seated, and when you start to work on them, they can have quite powerful releases. So just bear in mind that whilst it's okay to try these things completely alone, getting some sort of structure or advice from a professional can be massively beneficial. And then we have heat packs or ice. A lot of people think that it's only heat that can ease muscle tension and ease pain, but actually for some people, ice works better than heat. So again, if you've tried heat packs and you find that they don't really work particularly well for you, then do try an ice pack. Alternating between heat and ice can really stimulate blood flow. It can really start to accelerate healing, but it's not a challenge. It's not something that you feel that you don't feel as if you have to do it, that it's going to be so beneficial that you have to, even though it's excruciating or even if you don't like it. This is all about relaxation. So if you're doing something that scares you, if you're doing something you don't like, you're going to find it really hard to relax. Essential oils. Essential oil lavender is one that I always talk about, but it's a love or hate oil. But lavender is great for physical and for and emotional relaxation. Same with rosemary. That can be a really beneficial one for physical and for emotional release as well. Excuse me. Meditation. If you are okay with meditating, then that's a lovely way to address pain. It takes you out of, so a lot of pain is consciousness, and it takes you out of that conscious awareness of your pain. It focuses your mind on the here and now, and it's amazing how little pain you actually feel when you're not focusing on it. So try and find a meditative practice that you like. It could just be mindfulness. Mindfulness is a beautiful form of meditation. It brings you to the present, it brings your focus to the here and now. And again, it's really, really, really good when it comes to pain management. So that could just be something as simple as taking some time out just to focus on a clock, just to watch a ladybird walk on a leaf, anything that's bringing your attention to the here and now. Listening to a film, listening to a song or watching a film, but really immersing yourself in that film, immersing yourself in that song. Anything that's completely absorbing your attention is essentially mindfulness. And breath work. This can be really difficult when you're feeling in pain, because when you're in pain, we start to go back to that shallow breathing. So when you're in pain, things tense up. Your body thinks there's something to worry about. Your mind goes into fight or flight. Because your body's in pain, pain is a message. Pain is a message to our minds that our body is struggling, and that essentially puts us into fight or flight at some level. So bringing your attention back to your breath, taking deep breaths, breathing from the abdomen rather than from the shallow breath point, so your tummy is going in and out rather than your shoulders lifting up and down. Counting the breath in and out is a really nice way of bringing mindfulness into your breathing, so you're getting the optimum oxygen blood flow through the heavy breathing, through the deep breathing, and then you're getting the mindfulness element of the counting as well. But that's a lovely way of doing it. And again, it can be quite difficult to do that when you're in pain, because you're moving muscles that you really don't want to move, so there can be a bit of resistance. If you find that, just focus on something else and then bring your mind back to your breath again. I hope this helps. If you are struggling with back pain, then, like I say, please don't be concerned. If you are really concerned, then go and speak to your specialist, see if the results of your MRI or your lap, whatever it is that you've had for your diagnosis, just check in with them, just check in with your consultant, with your GP if you want to. But the main thing is not to worry. The main thing is to, again, same with everything, check in with your endo, check in with your cycles, with your triggers, just try and understand exactly why you're getting the back pain. Is it a cause of your endometriosis? So is it historical, emotional or physical trauma? Do you have any of the other underlying physical or emotional causes, if you will? Is it simply a symptom? Is it deferred pain? Once you understand your back pain a little bit easier, a little bit better, a little bit deeper, you can then start to alleviate it a little. I hope this helps wherever you are on your endometriosis journey. I wish you all the very best. Thank you so much for tuning in today. I really hope that you found this podcast helpful. If you did, please hit follow so you can listen to more, and please also share it with anyone else who you think will benefit. And don't forget, if you're looking for women's health treatments, workshops or support within your workplace, you can find all of my services, including our monthly virtual clinic, over at www.healthyandwomenshealth.com. I'll see you next time.